COVID case numbers in New South Wales have exploded way beyond what most people were thinking was possible or likely just 2 weeks ago. Today's figure is the highest number of daily cases recorded in any Australian jurisdiction and just under the total infections recorded nationally yesterday. So more than 20,000 cases today and 6 deaths. And looking at hospitalisations now, there are now 832 people in hospital with COVID. That's up 85 from yesterday and continuing that steep increasing trend. The one positive outlet, I mean, it's not good for anyone who's in intensive care with COVID, but at least those numbers are staying stable for the moment. They've been in the 60s for the last several days and now 69 people in intensive care. Here's reporter Sophie Wainwright in Sydney.
So, to be precise, 21,151 people have tested positive to COVID-19 in New South Wales in the latest reporting period. That's up from the more than 12,000 cases we saw the day before. Case numbers nearly doubling for the second time in 3 days. And if you look at where we were a week ago on Christmas Eve, we had 5,600 cases on that day. So really a huge jump in daily cases.
And you're at Mrs Macquarie's chair, a key vantage point for tonight's fireworks. Preparations underway for tonight?
That's right. All indications are pointing to smaller crowds this year across Sydney, and that's for a range of reasons. I mean, some people are quite reluctant to come out in crowds because of this huge, increase in case numbers, and also because vantage points like this one are ticketed and pre-booked, some for free, others for a fee. Usually at this time of day, though, if you were looking around a place like this, you would see people with their tents who have camped out and really staked it out for the best seat in the house for the fireworks, but really there's no one around here. I mean, there's some security guards in high vis, lots of fences up. We had the bomb squad here just a moment ago and a few media people, but it is quite quiet at the moment. It seems like everything is looking like it is ready for tonight. The fireworks are all ready to go off at 9 o'clock and at midnight, and in just about an hour's time we'll have the first rush, if you like, of people who have pre-booked and have those tickets to come here at Mrs Macquarie's chair ahead of this evening's events.
Sophie Wainwright reporting there from Sydney. Let's head south into Victoria now. It's recorded a 15% rise on yesterday's COVID case numbers, close to 6,000 new infections. Here's reporter Emilia Turzon in Melbourne.
Well, cases just keep rising here in Victoria as well, as predicted. Fortunately, not to the same rates as you're seeing in New South Wales. There was just under 6,000 COVID cases detected in the last 24 hours. That's a rise of 15% on the previous 24 hours. However, that is actually a slower rate of COVID cases than we've seen in previous days, potentially pointing to the rate of infection slightly slowing. However, there was far less tests done in the last 24 hours as well. It was down to 66,000, which could also be behind this slowing rate of infection. When it comes to hospitalisation rates here in Victoria, 428 people are now in hospital at the 7-day average, so the rate of admission over 7 days into hospitals, that's also rising, but not at very high rates yet. And sadly, 7 people have died in the last 24 hours. That follows a day when we had 14 people die in 24 hours. Overall, there's 28,000 active cases of COVID here in Victoria at the moment.
And Amelia, we can see that queue of people behind you there at a testing clinic. What's the pressure on those testing clinics like there now?
Yes, this queue has been lined up around the corner of this testing clinic near Melbourne since 6 a.m. this morning. People have been lining. I was actually at this testing centre yesterday and people had been lining up in the baking heat, 36 degrees, 37 degrees, for 5 hours to get tested. And that just speaks to the pure pressure that's being put on the PCR testing system here in Victoria. As I mentioned, testing rates actually dropped in the last 24 hours to 66,000. It's unclear why that is the case, but potentially it's because yesterday the heat was so bad that some testing clinics had to close for safety reasons. And that's because we have marquees in these testing sites. We have doctors and nurses dressed in full plastic PPE in this heat. We also have heard from the government that some sites had to be closed for safety reasons. And today, indeed, we have several dozen less testing clinics listed, and some are already at capacity this morning.
And how are New Year's preparations going there in Melbourne?
Well, despite the COVID cases still rising, we are heading miraculously in Victoria after a very tough year into a relatively social gathering-free New Year's Eve. The Victorian government, it's decided that it won't be setting off fireworks from rooftops, and that's to stop people going into all parts of the city to see the crackers. It means that this morning along the Yarra River, there weren't the usual people camping out to try and get the best vantage point. Instead, there's been 4 sites set up around the city where people have had to pre-book tickets, and tickets have now sold out, and that's where people can go to see a select amount of fireworks being put off. Overall, authorities are just urging people here to have a COVID-safe Christmas so we can beckon in, hopefully, a better new year.
And Amelia, are we expecting a media conference from some Victorian officials today?
Yes, we will expect another Victorian press conference to hear today, and that's because we're expecting to hear from the Victorian government about its reaction to the National Cabinet decisions yesterday.
Right.
We know that Victoria is accepting the new definition of close contacts, the fact that you have to now be with someone in a household setting for 4 hours to be defined a close contact. But we are expecting to hear from the Victorian government today about what exactly this will mean. What will this mean for testing rates? What will this mean for COVID cases? So expect more detail on that today.